Bruce Willis's wife is turning a personal diagnosis into a push for change. Heming Willis was at the state capitol urging support for a bipartisan bill to collect more data on the terminal brain disease that's impacted her husband, a disease the state does not currently track. She says that more data could help drive more research, bring in more funding, and ultimately move scientists closer to a cure. Thanks for joining us here for Fox 40 News at 6:30. I'm Eric Harriman.
And I'm Nikki Lorenzo. Fox 40 Capitol reporter Heming Willis spoke one-on-one with her about her push to give families more answers.
How is your husband doing?
I think that he is doing well, considering, FTD is a really unkind disease.
Emma Heming Willis, wife of actor Bruce Willis, sharing that update about her husband 4 years after he was diagnosed with frontotemporal degeneration, a type of dementia often referred to as FTD.
Bringing awareness to FTD is vital.
The disease often strikes earlier in life than other forms of dementia like Alzheimer's. For Willis, it's no different. He was just 67 when he was diagnosed. FTD primarily affects the frontal and temporal lobes of the brain, causing shifts in personality, behavior, and importantly, memory loss. For many patients, symptoms progress over time, with life expectancy often ranging from 7 to 13 years after symptoms first appear.
It's taking people in the prime of their lives.
Heming Willis came to the state capitol to raise awareness about FTD and urge support for Senate Bill 1047. Currently, California does not track or count the number of people diagnosed with FTD, but if SB 1047 is passed and signed, the legislation would change that, expanding the state's neurodegenerative disease registry to track and collect data on FTD diagnoses, helping researchers better understand how prevalent the condition really is in California.
Getting this bill passed is really important. If we aren't counting people, we are not going to be able to get the research and the support that we need to be able to help people and their families through this disease.
Kelly McKenna, CEO of the National End Chronic Disease Organization, notes New York is the only state that tracks FTD. She hopes California, with the passage of SB 1047, will become the second.
The more data that we can have to understand locally what's going on with each population, the better that we can ask questions and the more closely we can get to a full picture of what this disease looks like in our country.
SB 1047 has already garnered bipartisan support, but it still faces a key hurdle, the Assembly Appropriations Committee. Lawmakers there will review the estimated $2.7 million cost of the bill, an amount supporters say is relatively small compared to California's $350+ billion budget, and they argue it's worth it to achieve the following goal:
improve treatment options and ultimately find a cure.
To the rest of our legislative colleagues, both Assembly and Senate, let's get this done.
Heming Willis vowing to not give up.
If it doesn't pass now, we'll be back again next year.
So now the big question, will the bill advance? We'll know the answer after the Assembly Appropriations Committee meets next Thursday. At the state capitol, covering local news that matters, Heming Willis, Fox 40 News.